Hi, I'm Mohammed Hasan Khan. I'm an interventional cardiologist and I also specialize in structural heart disease. Hypertrophic cardiomyopathy is an abnormal thickening of the heart muscle that's a genetic condition. It's actually the most common genetic condition of the heart that you can be born with. It affects about 1 in 500 people. Essentially, what happens is the heart muscle gets abnormally thickened, and that can cause difficulty in the heart pumping out blood to the rest of the body. People are born with the gene that can cause hypertrophic cardiomyopathy that they inherit from their parents. However, it's usually diagnosed in middle age. The vast majority of people, it's never diagnosed, but it's still because it doesn't cause symptoms. However, it's still important to know because one of the things that can cause is sudden cardiac death, and that might be the first sign that you have had hypertrophic cardiomyopathy. So, one of the more common but unfortunate ways that hypertrophic cardiomyopathy is diagnosed is when you have a young athlete or a young high school player who's just exerting himself or herself and suddenly they have cardiac arrest and they become unconscious, and in most cases, they cannot be resuscitated. This is because hypertrophic cardiomyopathy puts you at risk of having an abnormal heart rhythm known as an arrhythmia that can cause sudden cardiac death. Because the prevalence of hypertrophic cardiomyopathy in human beings is about 1 in 500, it's low enough that we don't routinely do screening echocardiograms or electrocardiograms, which is one of the ways you can diagnose this. Instead, we pick people selectively who have a diagnosis of hypertrophic cardiomyopathy and we screen their first degree relatives, their parents, their siblings, their children. And initially, you start with screening if they've inherited the gene, and if they have, then you continue doing serial echocardiograms and ECGs to determine when they're going to be affected by it. So, if one of your parents has hypertrophic cardiomyopathy, you have about a 50% chance of inheriting that gene and developing hypertrophic cardiomyopathy later in life. If both of your parents have hypertrophic cardiomyopathy, which is a little bit rare because it's not a very common condition, it can increase your risk of developing hypertrophic cardiomyopathy up to 75% or more than that. Usually, when you have any difficulty breathing or chest discomfort or palpitations, particularly when you're trying to exert yourself, it's a sign that you might have cardiac disease. So that's a sign that you should go to your doctor, and you probably need at least an electrocardiogram or you need some type of testing to evaluate whether you have a heart condition that might be causing this. So there are two important things in hypertrophic cardiomyopathy that need to be treated or at least addressed. One are symptoms where you are unable to exert yourself, you're limited due to difficulty breathing, due to chest discomfort or anything else. In that case, you may have to be on certain medications that can relieve some of the obstruction that thick heart muscle is causing. If the medications do not give you complete relief, or if they give you incomplete relief, in that case, then you might need to go for procedures to reduce the thickening of the heart muscle itself. So what we plan on doing is we are planning on coming up with a robust system where people who are diagnosed with hypertrophic cardiomyopathy, we evaluate them, we screen their first degree relatives who might also be at risk of that, and if needed, we do the right medications to kind of help them with their symptoms. If at some point medications are not helping, then we can even offer them procedures including alcohol septal ablation and surgical myectomy, where we can relieve some of that obstruction to the blood flow and help them feel better.